Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Ellen Kamai, the natural nurse who will help you take the leap to ultimate wellness.
Greetings, and thank you for joining me, Ellen Kamai, the natural nurse, for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. You can listen on air or online at iHeartRadio, Odyssey, TuneIn app, smart speakers, or many other podcast venues. You can also go to nccradio.org or on our own award-winning WHPC app. Herbally Yours brings you the latest information about the many facets in the world of natural living. And today we're so happy to have as our guest Dr. Edward Feinberg, who is a DMD, that's a dentist, and we're going to be talking about challenges in dentistry to achieve excellence, and in particular, restorative dentistry. Dr. Feinberg is a graduate of Tufts University and practiced dentistry in Scarsdale, New York for more than 40 years and is now practicing in Arizona. He is the successor to a unique tradition of restorative dentistry. And you can find him at theonwardprogram.com. And we'll have all those with links, so you can look there at the end of the show. So also, thank you so much for writing the book, Open Wide, Essays on Navigating Challenges in Dentistry to Achieve Excellence, which gives more information about what we'll be talking about on Herbally Yours today. So welcome, Dr. Feinberg.
Thank you.
Let's go back in time and share with me and our audience what made you decide to become a dentist in the first place?
Well, I grew up in dentistry. So my father was a master and pioneer of full mouth reconstruction and crown and bridge dentistry, which I've been doing all my whole life. My dad was very well known in his field at the time. And over the years, I've seen changes in my profession that I don't like. I have a very unique background. I have more than 100,000 pictures of crown and bridge cases that go back to 1950. All the teeth prepared and handled the same way, and the cases followed for decades with x-rays. And I don't know any other practitioner who has anything like that. So there are very definite basic principles that contribute to a successful outcome or a very high percentage of success when it comes to crown and bridge dentistry. And I see a lot of those principles being violated with some of the newer techniques and the newer approaches to this field. So I'm hoping to educate dentists and help them improve their outcomes with something that's tried and true.
Well, that's a wonderful description. Now, let me ask you this. Perhaps you've heard of the word, let me know if you have, biomimetic dentistry. Are you familiar with the technique and what they're doing?
I'm somewhat familiar with it. I think that primarily relates to shade matching with artificial materials blending in with natural tooth structure and natural tooth colors.
That's part of it, but also
I'm most concerned with prevention of disease.
Well, right, of course, that would be first and foremost. But when somebody does need a bridge or restoration, I know that there are dentists within that biomimetric field who are much less likely to pull the tooth, but actually restore the tooth. And I don't know that's part of what you're talking about with restoration dentistry.
It's absolutely what I'm talking about. I break my neck to save the teeth first. And I have a lot of techniques that allow me to save teeth that are, for example, flush with the gum, and I don't build them up with posts, or I don't try to build them up in any way, because my techniques are focused on the tooth structure that's below the gum rather than above the gum, which every institution teaches. So I save a lot of teeth that many dentists want to extract. And what I see is a lot of dentists having difficulty with crown and bridge, but they're very, very adept at placing implants. So they would rather extract the teeth and place implants because that's all they know how to do. Like if all you have is a hammer, everything looks like a nail. And that's what's going on in my field.
Dr. Feinberg, that's a really good example. So in terms of a bridge, I have to say I have one of those. And when I went in to get it done, I didn't know what it involved. And it seemed like I had a space where one tooth had been extracted. But then I had two perfectly good, excellent teeth next to that space. And those two teeth had to be compromised in order to put the bridge on. I imagine that's normal protocol. Like they had to be ground down or whatever they did to them to actually attach the bridge. And that made me not so happy. Like I would not choose to get a bridge again because it seemed to compromise yet another two totally good teeth.
Well, that is a specific case. If you have, let's say, a perfect mouth, no periodontal disease, no fillings, and no crowns, then that is a perfect place to place an implant, and I would agree with you. But if the teeth around it, surrounding the space, have crowns, periodontal bone loss, big fillings, they're going to need crowns, that doesn't make sense to place an implant there because an implant only fills a hole or a space. It does nothing for the teeth around it. So the patient's problems are never solved. And I call the single tooth implant the signature of a piecemeal approach to dentistry. Because if you know how to do good crown and bridge work, you can change the architecture of the whole area. You can make the teeth smaller to put less stress on the supporting structures, which is the bone and the roots. And you can tie them together so that each tooth helps each other out rather than each tooth having to carry the load by itself. When you do all those things, usually that's the end of the periodontal disease, the end of the decay, the end of everything, and the patient's problems in the whole area are solved, something a single tooth implant cannot do. But because a lot of people don't know very much about crown and bridge, they look at crowns and bridges as tooth coverings rather than as corrective and prevention of disease.
So you have been writing and been very involved in leading various dental organizations for many decades. You wrote part of the textbook, The Double Tilt Precision Attachment Case for Natural Teeth and Implants. And I'm sure that's the kind of book that's more for dentists than for lay people.
Yes, that's true. And most of my work has been done for dentists. And most of my teaching efforts, my teaching website is geared toward dentists. And even this new book that I just wrote is primarily geared toward dentists and dental professionals. But I really think that that patients or the public in general will find it very interesting, and they'll be treated to an inside look at the profession of dentistry and make them think about what kind of treatment, if should they need any, would be best for them.
And of course, if they got the book, Open Wide, Essays on Navigating Challenges in Dentistry to Achieve Excellence, which you can get easily on Amazon, and you can just link to it from our website after you listen to the show. Certainly they could bring that to their dentist if they say, wow, I would like these kinds of techniques instead of some of the other ones.
One of the difficult things is that I'm swimming upstream while everyone else is going downstream. But I have the solid evidence behind what I'm doing. And so it's been very difficult for me during the course of my career to get professionals to understand that a lot of what they're doing is really going in the wrong direction and not the right direction. And a lot of people might look at technology and say, wow, that's a step forward. It's got to be better. That's not true. Technology is only a tool, not an end in itself. Some technology is good if it conforms to basic principles that contribute to success. But some technology is clearly violating basic principles that allowed my dad and I to have so much success in dentistry. And that's not good technology. That's a step backwards. And the patients cannot evaluate it, but a lot of dentists cannot evaluate it because they haven't been taught properly. That's what I'm trying to do. I'm trying to teach them and show them the basic principles that are required for successful outcome.
There's specific knowledge there, but perhaps you can share some of it, such as What is different about your method of creating crowns and bridges compared to what most dentists are doing?
Well, I would say that most of what I'm doing is based on solid engineering practices. If you build a bridge across the Hudson River, you have to have supports that are strong enough to support that bridge. You also have to do everything you can to minimize the forces that are going to be acting on the supporting structures. In the mouth, the supporting structures are the bone and the roots. I try to make my dentistry smaller, narrower. I try to tie the teeth together whenever possible to distribute the load. And I correct all the abnormalities, teeth hanging down too far. I want to bring them back up into the right alignment before I make dentistry. So I spend a lot of time with temporaries in order to correct all the things that are wrong. Because in dentistry, the whole ball game is the bone and the roots. And the way people get into trouble with losing their teeth is if something happens to the bone. So there are lots of things that contribute to bone loss. One is certainly everybody knows, and that's letting tartar and plaque and calculus build up, because that can cause the gums to become inflamed and that can spread to the underlying bone. But another cause is missing teeth, because what ends up happening is the teeth around the spaces drift and the teeth opposite the spaces erupt into the space. And then all the teeth start taking forces in abnormal directions. And when the body can't tolerate that, something has to give. And in human beings, one of two things happens. Either the bone goes or the teeth wear. Those are the two things that go wrong in human beings. So by replacing missing teeth, you are preventing that scenario from happening. And that's why it's so important. And there are other causes as well. If the muscles are not in harmony with the way the teeth come together, then you are having abnormal forces being applied to those teeth, and something is going to give. The reason crown and bridge is corrective is because of Wolff's discovery in the 1700s. And he discovered that bone is deposited and resorbed in accordance with the stresses placed upon it. So if you have loose teeth and you change the way the architecture so that the forces are being distributed properly, those loose teeth usually tighten up, and then you can make a case that will last. So I save a lot of teeth that people want to extract. And I'm able to get a lot of things to work that are miracles that most people would never expect could possibly work. And it's all based on solid engineering principles. And when I give lectures, I like to compare the major engineering disasters with what happens in the mouth, and because it's the same thing. And we're doing the same thing. So dentistry is very akin to structural engineering.
Well, that makes sense. And I want to remind our listeners, you are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. You can listen live or online and at www.nccradio.org, iHeartRadio, or whatever podcast venue you enjoy. For more information on today's guest or topic, you can email us at whpc@ncc.edu. And today we are talking to Dr. Edward Feinberg, and he's a graduate of Tufts University and an expert in the field of dentistry. And we're talking to him about information he shares in his book called Open Wide, which you can find on Amazon. And thank you so much for that interesting information. What do you feel about the kinds of things that people can just put in temporarily, like if they do have a space, but they can put it in every day or leave it there? It's like a temporary tooth rather than drilled into the bone.
I'm not a big fan because what happens is a lot of these have clasps or hooks that grip and put lateral forces on teeth. And so you're maybe doing harm by doing that and not really helping the area. Sometimes you can bond a tooth in temporarily, and sometimes you can do temporary crown and bridge. So I make a lot of temporaries with copper bands that seal the teeth properly. So when I make crown and bridge, I make my crowns and bridges on the idea of the mason jar cover, which is the best known thing for preserving food. And so I almost never get decay under my crowns. So I've had a lot of patients, and to help them, I would make temporary with copper band, put them with permanent cement, and they can go that way for quite a while until they're ready to do their crowns or bridges or whatever they need. So I would rather do that and correct all the things that are wrong in the temporary so that we can create health and maintain those teeth so that when they're ready to do the case, they can. One of the saddest things is when somebody comes to you and maybe they're down and out financially and they don't have the means to do major permanent work. Those people are usually turned away. And so I have something for those people, and I want those teeth there that when they're ready to do the case, the teeth are there and they could do it. It's so sad when those people are turned away, they end up losing the teeth. And now when they're ready to restore their teeth, they have major strikes against them, and it's going to be twice as expensive. So I don't think that's being a doctor. I think you're there to help people. So I have different options for treatment for not just patients who need sophisticated dentistry or who are candidates for that, but also people who are not candidates for sophisticated dentistry. And I get just as much pleasure from helping those people as from doing a big fancy case.
Well, that's great to know. Now, why do you have a focus and find that it's very important for people to save that original tooth first rather than extract it right away?
Well, my dad and I started doing implants when they first came to this country in the early 80s. I've done a lot of implants and I've seen everything. And I know they're not a panacea. I have had the patient where they lasted 20 years and that was it. And then you couldn't put any more implants in. And I think that a lot of people agree with me that the outcome of implants is not what people think it is. It's not a panacea. Not everybody's a good candidate for it. If you can't put good long ones in where they could support the dentistry, they shouldn't be done at all. But that's what's being done. I would break my neck to save teeth first. You can always take them out. So there's no guarantee about anything. But to me, success is, when dentistry is not lifetime, and there's a point at which dentistry needs to be remade, and it's different for everybody, and it depends on changes that occur. So I have dentistry in the mouth that I did that's in 40 years, and the changes were minimal and gradual, so they got away with it. They didn't have to replace the dentistry. But I have other patients that have to replace the dentistry after 10 or 15 years. And if the teeth are still in really good condition that you could make a new case, that's success. So that's how I look at everything. My job, I want to maintain their teeth as long as possible. If they need implants, then at a certain point, maybe that's the best treatment for them. Then we can always figure that out. And everyone's different. So you have to have out of the box thinking and critical thinking for each patient. My first inclination is to try to save the teeth unless it's obvious that they're not going to hold up, and then that's a whole different story.
Well, that's a great answer, Dr. Feinberg. Now, you have a website which is mostly for dentists called theonwardprogram.com. Onward, like onward and upward, onwardprogram.com. Is there a different website for listeners who are not dentists, or can they go there anyway just to find you?
Oh, anyone can go there. I have a documents library with all kinds of information on it. And the courses, they're geared primarily to dentists because I want to teach them these techniques.
Right, because how many people can you do? How many people can you do? That's like...
I know. Well, that's what I'm trying to do is train, because this was given to me. I grew up in it. And I feel obligated that it's my job to make sure that this is passed on. I don't like the direction of things. I know it's wrong. And I can't just stand idly by and say, well, that's the way it is. I have to do whatever I can to try to get my area of the profession on the right track. That's not true for all areas of the profession. I think they make huge strides in endodontics and orthodontics. But crown and bridge in a lot of ways has gone backwards. I see, I have, as I mentioned, I have 100,000 pictures. My dad was very farsighted and he started taking pictures in 1950. So I have the benefit of all the work that he did as well as all the work that I did. And in my career, that's 70 years of documented evidence. And materials don't make dentistry. It's the basic principles that are really important. So my dad came from a place in dentistry, roots of dentistry, where all they had were acrylic veneers, which is gold and processed acrylic. And a lot of those cases lasted 40 and 50 years. If you ask any dentist, they will tell you that they've had those patients come in with that kind of bridge work done 50 years ago. Yes, the acrylic doesn't, it's a porous material and picks up stains and doesn't hold up so well. We have some better materials, but gold is still the best material ever devised for dentistry. It holds up the longest. It has the best properties that are biocompatible. The thing is that most people don't want to show gold. That's a whole nother story. So I think it's very important to be honest about what you're doing, what the materials are, and how they're being used.
Well, talking about materials, you did mention gold. What are other best materials for dentistries, or maybe some that are very not favorable?
I like porcelain to metal restorations, as long as they're made on precious metals. And there are a lot of different alloys for porcelain to metal that you can use, and they all seem to work and handle the same way. So those restorations are great because you can seal the teeth like the mason jar cover, like I mentioned previously. There are other materials where you cannot do that. One is all ceramic restorations. They're what you call butt joint restorations because you make a ledge on the tooth and then you try to make that restoration to the ledge. You can't go beyond it, like with porcelain to metal restorations, because the ceramics will break. And they can never be sealed. So there's a place for them, and that would be like a model or somebody you want the extra aesthetics. And I think for the front 6 teeth on somebody that you pick, they're not susceptible to decay, you can do that, but you know it for what it is. And then there's this other material called zirconia, which has become very popular because it's cheap and white, but it came from nuclear power plants and it belongs there, in my opinion, because it's so hard that you can't possibly, you have to take these things off. As I mentioned, dentistry is not lifetime. It's very difficult to cut that off. And you could do a lot of damage trying to take one of those things off. And then the second thing is they're all butt joint restorations, which I don't believe in, and you can't solder them together. So this is a material I feel that's very unsuited for dentistry. But because most people think of crown and bridge as tooth coverings, they're only looking for something cheap and white that they could stick in a hurry. And so it's become very popular. And it's wrong because no tests were ever done on it. And I think that's wrong. If you believe in science, I really think that anything new that comes down the pike must be compared to the standard that came before. Otherwise, you are not advancing. There's other technology that's great. But all that matters is the end product, not how you got there. The end product, for example, of what the CEREC machines that make all ceramic restorations, and they mill it right there, chair side, and put it in. That's no different than the old high-fusing porcelain crowns that were baked in an oven in the 1960s. We knew what was wrong with those. The end product is exactly the same thing. A lot of younger practitioners don't know where dentistry came from. So they're easy prey for $100,000 machine like that. And while it looks impressive and looks modern, teeth in a day, that's great. There's a lot of things wrong with it. And a lot of dentists are having difficulties and problems with these restorations, which are obvious because we knew what this were from the 1960s.
Well, that's really good information. So, there is a buzz, and obviously you've heard this too, and we'd love your opinion, about some people avoiding root canal. And they say that once you have a root canal, an infection is going to be developed in the root canal, and it's going to kind of be there for a long time to come, and that it's a problem. What is your thought on that?
Well, at one time that was true. Inside the teeth, there's a canal system. So each root usually has a main canal. Sometimes it has 2. But what's unseen are flutes of tissue that connect in between that you can't see and you can't get at with files or the usual irrigants that are used in root canal therapy. However, that's one field that I mentioned and they made a lot of advancements in. And there were 2 methods of addressing the anatomy that you can't see. One is with lasers, and I worked with somebody who was an expert in it in New York, who was like one of the finest practitioners I've ever seen in endodontics. And he got great results with that. And the other is something called the gentle wave, which is like a washing machine. And it works like with negative pressure and is able to get the irrigants into those areas that previously we weren't able to reach. Between those two techniques, that's changed the whole idea of root canal therapy completely. And root canal therapy has a very high percentage of success. To not save the teeth and have them extracted and not do the root canal therapy would be like a crime, I think. That's a good tooth. And all you have to do is clean it out thoroughly and it's going to be fine. People remember what it was like before. And when I started my career, they didn't have these instruments. And I did some root canal. And I had the patient that the thing blew up after 20 years. And nobody knew why at the time. But now we know why. Because tissue was never addressed that was in between that you couldn't see at some point, and who knows why they blew up. But now they have so many great technique in endodontics, and there's some really fine practitioners that it would be an absolute crime not to have root canal therapy and extract the tooth.
Because at least that could save the tooth.
Correct.
So that sounds great. And, it's important, as you state, to have a variety of options for dental treatment. And that's something that you do talk about in your book, Open Wide. So that's a really, really good thing to know. And what would you just give as a outgoing little statement about what people should do to best care for themselves from a dental perspective?
Well, number one, as I mentioned, the best thing you can do for your oral health is regular hygiene, going regularly to have your teeth cleaned, and also home care. That is the single best thing that you could do for yourself. Should you need any treatment, then I think it's important to get some opinions. Just because one practitioner can't save a tooth doesn't mean another one can't.
Well, I thank you so much. I thank you so much for all that knowledge, Dr. Feinberg. And
you're very welcome.
And for putting it all in a book that people can find.
You have nothing to lose by getting an opinion, but I would seek out trying to get the best referrals. Like, for example, if you needed implants, they should be restoratively driven by the person who's going to make the restorations. So if you don't know who to go to, you could call up and get a good referral from an excellent oral surgeon. They know who the better practitioners are, and you're likely to get a better referral that way.
And thank you, listeners, once again for tuning into Herbally Yours, produced in the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, email us at whpc@ncc.edu. This is your host, Ellen Kamai at naturalnurse.com, inviting you to join us next week for another edition of Herbally Yours. Until then, stay healthy.